I want you to imagine a scenario, and it's pretty common. Let's say you've already had a lip filler procedure. You're looking at yourself. Could be in the mirror, could be on social media, or a selfie, and you're noticing that there is something a little bit off. You're wondering, okay, do I need more filler? Is there asymmetry? Do I need less filler? This is actually a really common issue that happens to people after they've had lip filler. So what do you do? Hi, I'm Dr. Melissa Chiang, and I'm a board-certified dermatologist and master injector. I have been in the aesthetic field for over 20 years, and I spend most of my time in clinic doing injections, but as well, I also spend a fair amount of time training, and I'm a national trainer for Galderma, one of the largest aesthetic companies. My focus is on natural beauty, and what I mean by that is I like to look at each individual's face. I'm not trying to create cookie cutters. What I'm trying to do is create more harmony in that person's face for that person's features that also speak back to that person's ethnicity. After years of doing injectable treatments, I realized that there is need for alternative treatments so that we can keep people looking natural, but as well continue to optimize our results. So this year, I've been very interested in chemical peels. And if you're interested in learning more about medium depth chemical peels, click here where I'm going to go into more detail about a solid CO2 TCA medium depth peel. The second treatment that I've taken an interest in and is becoming more and more popular is actually dissolving filler. And specifically, I think there's actually enough need to create a filler correction clinic in my practice. In this particular video, we're going to focus on one particular patient who had lip filler. And her story is that she wanted a certain look. She wasn't sure how to get there. And so what happened was she had filler, and then she had filler again and again. And actually each time when she came home, she realized she wasn't getting what she wanted. And ultimately what we did was we dissolved the filler, not all of it, but a fair amount of it, and she was really happy with her look at the end. While this video is specifically going to focus on lip filler, the strategies that we're talking about can be applied to other areas as well. And so I find that areas that I'm looking at a lot for dissolving are around the lips, including above the lip, but also around the eye area too. That's a super common area where people can get overfilled. And then there are also times where it's actually full face filler that needs to be taken down a notch. But any area of the face where there's too much filler, or where the person doesn't like the result, or the result doesn't look right, we can do this treatment so long as the filler is hyaluronic acid filler. And the reason why hyaluronic acid filler is our only target with this particular treatment is that we're going to be using an enzyme which is called hyaluronic, and so that helps your body metabolize that hyaluronic acid in about 24 hours. If you like this video, hit the like button, as well as subscribing and hitting the bell icon, because that way you'll stay up to date with future treatments and procedures as we post them. In addition, if there's something particular that you really want to learn about, put it in the comment section. One fundamental question is, when do you know if you need filler correction? And I kind of break that up into two categories. The first category is if you look like you've had filler. So if you are wanting natural beauty, you can't have beauty where it looks like something is off in your face because you've had too much filler. And so if it is obvious you've had filler to someone who's passing you by on the street, then you need a filler correction, in my mind. The second category is where maybe no one else knows that you've had filler, but you don't like the result. And it seems off to you because it doesn't go with the features that you're used to seeing, or it doesn't fit with your aesthetic. So either of those can be reasons for filler correction. Patients in that second category where they feel like they look a little bit off or not quite how they want to look, they're going to know that they need that filler correction. And I feel like a lot of times they know they need it, but they don't realize there's a solution to it. So that's part of the reason why I wanted to post this video. But that first category where it's obvious that you've had filler, sometimes patients don't realize that they fall into that category, because I think what can happen is we get filler and we maybe have a little dopamine rush because our features have changed. Maybe we've gotten a compliment, and then maybe we want a little more and a little more and a little more. And then slowly our reference point to what is normal starts to shift. And so I think in that category where it looks like you've had filler and it doesn't look quite right, sometimes you may need an experienced eye to tell you what's going on. Sometimes it could be a friend. Sometimes it's like you'll just notice in some pictures things look a little bit off depending on the expression and the lighting, and those are things that you should pay attention to. Is there a way to remove lip filler? Thankfully, the answer is yes. And what we do is we inject an enzyme, which is called hyaluronidase, also goes by the names Hyaluronic or Vitrace. And when that enzyme is injected into the same vicinity as the filler, it breaks down that hyaluronic acid and your body can then metabolize it. Now, the thing to note is that hyaluronidase is specific for hyaluronic acid. So it breaks down hyaluronic acid fillers, which are by far the most common type of filler that's placed in the lip. However, if you have a different kind of filler, say you have a permanent filler like Bellafill, or someone has silicone in their lips, hyaluronidase is not going to be effective in breaking down that filler. Patients often want to know, what is the process for dissolving hyaluronic acid filler? And if you've already had a filler injection, the procedure will seem very familiar to you, but in our clinic, what we do is we typically will start with the topical numbing medication, and then after we wipe the medication off and cleanse the skin, I will inject the hyaluronidase using a needle into the areas where the filler is. Now, sometimes it is very obvious. You can see the filler through the skin, and in that case, it's very easy to hit the target. However, sometimes it can be a little bit more challenging to know exactly where to go because let's say the skin is a little bit thicker, you want to get to the right depth. And in that case, we have this very useful tool in our clinic, which is ultrasound. And we can use the ultrasound to try to visualize where the filler is. As well, sometimes the filler can actually be encapsulated. And in those cases, and patients who have encapsulated filler will oftentimes know they'll be like a hard nodule. And sometimes they'll even have had multiple Hyaluronic injections. But if that Hyaluronic doesn't get into that encapsulated specific area where the filler is, the Hyaluronic will not be effective. So we have had success stories where patients have had filler on multiple occasions with another provider, but when we use the ultrasound, we're able to target it precisely. The Hyaluronic sometimes burns a tiny bit, but in our clinic, we mix it with a little bit of numbing medication, so that's a very transient feeling. And the Hyaluronic starts working right away. So we will be doing a little bit of massage to make sure that we get nice feathered smooth edges, and oftentimes, even during the first 10 minutes, we can start to see that result. But we will send the patient home and ask them to send us a picture about 24 hours later so that we can see what the final result is. Typically, after injection of hyaluronidase, kind of depends on how much is injected. So if we want to do a lot of dissolving, then we have to inject more hyaluronidase, and that can make the lips more swollen. But if it's very focal, a tiny little bump, say, that we're trying to inject, then actually the filler will dissolve and you'll look pretty normal. So there's like a range of reactions afterwards. But if you come in and you're going to have this treatment, we will be able to tell you what we're expecting in terms of what the next few days look like for recovery. How many sessions does it take to dissolve filler? Dissolving filler is an art and a science. So the thing is, sometimes we just want to dissolve a little bit, and sometimes we want to dissolve everything. So if we only want to dissolve a little bit, then the way that I usually approach it with the patient is I ask them if they're able to come back if we need to do another session, because I want to be more conservative. I don't want to dissolve too much filler. I want to dissolve step by step until we get to the place where we're trying to go. The amount of hyaluronidase that needs to be injected depends not only on the quantity of filler that was previously injected, but also the type of filler, because there are some fillers, and these are typically the longer lasting fillers, that are much more resistant to breaking down from hyaluronidase. They can be broken down, but it can take a lot more product. So dissolving filler is kind of like an educated guessing game based on the amount of filler we're trying to dissolve, as well as the type of filler that we are trying to dissolve. On the other hand, if a patient, let's say, has a lot of filler and they just want to go back to what their original features were, what we could do in that case is we can err on the side of putting a lot more hyaluronidase in, because we know that the patient would rather have everything dissolved rather than to do it step by step by step. As well, using the ultrasound, we can actually see changes in the quality of the filler once that hyaluronidase hits the filler. It turns kind of from a black to a gray, fuzzy, cloudy picture on the screen. The downtime from this procedure ranges from 0 to probably a couple of days of swelling if we're doing the lips and we need to dissolve a lot of filler, and then a period where the lips are a little bit deflated, which could even last up to 2 weeks. One very common concern is, oh no, if I get my lip filler deflated, how long do I have to be before I can restart the process and get beautiful lips without migration or other issues? And the thing is, it is probably best to wait about a month between hyaluronics, which is dissolving, and refilling, because you want to give that tissue some time to heal. Sometimes patients are very reluctant to go for that period of time without having filler because they like having more to their lips. They don't want to go back to not having lips, but they also don't want to look unnatural. So in that case, I think PRF, which is using your own body's platelet-rich fibrin to go into the lips, is a good interim solution. Thank you for watching this video today. I have really enjoyed talking about some of the common questions for hyaluronidase injections or for dissolving filler. I think this is really important information. If there are any questions that I did not answer, please feel free to write them in the comments. If you like this video, don't forget to like it and subscribe to it. Thank you again for watching.